Have you ever come across a baby that has this or this? Or do you have a baby that has this or this? This is umbilical hernia and umbilical granuloma. Today in this video, I'm going to tell you everything you need to know about umbilical hernia and umbilical granuloma so that you will not run helter-skelter. If your baby has this medical condition, you will know what to do as a mom or a dad, and you're going to see your baby's pediatrician afterwards. Make sure you sit down and watch this video till the end because it is very, very important and no knowledge is a waste. Beautiful people, you're welcome back to my YouTube channel. My name is Cynthia and this is Ask Jason's Mom. If this is the first time you are coming across my channel, you're welcome. Thank you for stopping by. Please make sure you subscribe, you like this video, and leave a comment in the comment section. And if you are a returning subscriber, thank you. Thank you for always coming back to support your girl. I love you, love you, love you, love you, love you. So today we'll be talking about everything you need to know about umbilical hernia and umbilical granuloma, so that when you come across a baby with this medical condition, there is no need for you to run helter-skelter. You just know the right thing to do, and afterwards you see your baby's pediatrician. Okay, so make sure you sit down, don't go anywhere, watch this video till the end and give it a thumbs up. Okay, before we start, I would like you to know what an umbilical cord is. If you're not a new mom, you should already know, but if you're a new mom and you don't know, when you give birth, the umbilical cord is connected to your placenta. Okay, that's where your baby gets nutrients, everything they need to get while they are inside of you from. Okay, they don't eat from their mouth. The nutrients, the medications you might be taking for your baby will all go through the placenta, through the umbilical cord into your baby's bloodstream. So now when you give birth to your baby, they separate your baby and the placenta or from you by cutting off the umbilical cord midway. Now they are going to attach a clamp to it to avoid air from going in or anything from going in, dirt and all of that. It will be clamped midway between your baby's belly button and the remaining of the umbilical cord. Now you need to care for your baby's umbilical cord so that the navel will close properly. After the umbilical cord comes off, before it closes up, for some babies it might close up successfully and neatly, while for some baby they might develop umbilical hernia or umbilical granuloma. So we are going to start with umbilical granuloma. What do you need to know about umbilical granuloma? Umbilical granuloma is a small, moist, pink or red lump of tissue that sometimes develop in a newborn's belly button when the umbilical cord stump falls off. Now, this is not an infection or a serious condition, but it needs to be treated to avoid further complications. Now, what can actually cause this umbilical granuloma? This can occur when the umbilical area is not completely healed. Okay, that's why it's important to care for the umbilical cord so that it can fall down neatly and close up very well. So make sure you care for the area very well. Another thing that can cause it is when they have extra tissue, when an extra tissue forms when the umbilical cord area is still healing. So this can result to umbilical granuloma. Another thing that can cause it is when the area remains moist and slightly irritated. Okay, when you apply something that can easily get it irritated, this can lead to umbilical granuloma. That's why I always tell people that used to apply toothpaste on umbilical stump to fall off, no, don't do that. Or herbal mixture that you apply on the area, it can easily get irritated and lead to umbilical granuloma. Another thing that can cause it is mild infection, or when there is delay in the cord separation, when it takes time for the cord to fall off. Usually it is normal for it to fall off within 4 to 1 week or even 2 weeks, but When it gets to 2 weeks, it's already prolonged. So make sure you care for it. You use methylated spirit and clean cotton wool to clean the area properly. If you've confirmed that your baby has umbilical granuloma, make sure you confirm with your baby's pediatrician if it is okay for you to carry out this home remedy. Now, what is the home remedy? Get a clean bowl of water and use cotton swab or cotton wool to clean over the area. I said clean water. I did not say add antiseptic. After you clean this area, go in with a little pinch of salt. Look at the way I say go in with a little pinch of salt. Take a little pinch of salt and drop it around the area. Leave it for like 10 to 30 minutes and then you wipe it off with a clean gauze. You should do this twice daily for a few days and you're going to watch it close up. It is going to work like magic. I have a lot of mothers that has confirmed that this salt remedy works for them. Now, if you choose to go for medical treatment, your baby's pediatrician might use silver nitrates. This will help with the treatment of the granuloma and it will dry up the area. Another method is the cryotherapy, but this is rarely used. Thirdly, your baby's pediatrician can carry out ligation, which is cutting off blood supply to the area to stop the overgrowth of tissue in that area. Lastly, your pediatrician may give your baby antibiotics if the area is infected. Now, the important things for you to note about umbilical granuloma is that it is not painful, okay? It can actually cause discomfort whenever something is touching it. Maybe your hand is going there or the diaper you are putting on your child touches the area. That's when it can be uncomfortable for your baby, but it is not painful. Then I would like you to know that it is not dangerous, but if it is left untreated for a long time, you may have to worry, okay? Now, another thing you need to note is if it is infected, there is problem. You need to see your baby's pediatrician, okay? If it is infected, you need to see your baby's pediatrician. Again, it can go on its own, but treatment will facilitate healing, okay? So it's important for you to carry out the home remedy or you see your pediatrician for proper medical treatment. Is it preventable? No, but good hygiene helps. You should make sure you take good care of your baby's umbilical cord so that it heals properly and heals completely to avoid umbilical granuloma. Now, how can you care for the umbilical granuloma? Make sure you keep the area dry, okay? Don't go and start applying or rubbing all the whole concoction. Maybe you call grandma will tell you apply this one, your neighbor will tell you do this one, another person will tell you do this one. Please just try and keep the area clean and dry always. Then when you are wearing your baby's diaper, put the diaper beneath the navel. Don't use the diaper to close your baby's navel or probably put the navel to be tight. Even if you, after wearing the navel and it is towards the navel, you can fold that upper part a little bit. You can fold it to avoid discomfort so that it will not touch the lump. And then don't try to drag this stump or press it. Don't try to drag it or press it. Just leave it. Let it be. Please, mothers, please. Again, avoid using alcohol on that area. Avoid using alcohol or baby powder. You go and start applying baby powder on that area. Please, unless your doctor tells you otherwise, don't use alcohol or any powder on that area. And then if you've opted for home remedy to treat the umbilical granuloma, if after 1 week or 2 weeks it has not closed completely or it has not healed, make sure you go and see a doctor. Go and see your baby's pediatrician. It is very, very important. Now, this is all you need to know about umbilical granuloma. Moving on, we go to umbilical hernia. Now, what is umbilical hernia? It is a soft bulge or a swelling around the belly button. It usually happens when the intestine pushes through the abdominal muscles in the area where the umbilical cord passed through, okay, to form a bulge. And it usually happens to 20% of newborn babies. Now, it is not treatable, it goes on its own, and you can see it in premature babies or babies that are born with low birth weight. I already told you that the umbilical cord helps to transport nutrients from the mother to the baby. So when the baby has been given birth to and the umbilical cord has been cut, it is natural for the abdominal muscles to close, as in where the umbilical cord passed through. So after the thing has been cut off, the abdominal muscles will start closing, but sometimes it will not close completely. It will leave a little space before closing completely. Now this is going to create room for the intestine. Maybe the baby has finished eating, and while the food is passing through the intestine, it will just see that opening or space, and it is going to push through that space, and that's why you have that bulge in the belly button. Now it might not be the intestine that will push through that space, it might be a fatty tissue that might push into that space. That's why it is a soft bulge. It is not hard, and then it is not painful. You only notice it very well when your baby is straining, your baby is crying, or when your baby coughs. And that's when you can see it. Sometimes your baby might be lying down and the bulge will not be there, but if your baby is standing, or your baby you fed your baby is in a sitting position, you're going to see it bulge out. And sometimes this thing can remain like this until the age of 2, okay, and then it goes in. I know some of you will say you have seen some adults or some children above the ages of 2 years or 3 with big belly button. Don't worry, we'll get to that. I'll tell you why it is so. Like I said earlier, it is not painful and it goes on its own, but you need to seek medical help if after 1 to 2 years the thing has not gone back inside. My baby had it, my second baby had it, and I think after 8 to 9 months it went on its own. Like the belly button was so flat. So for some adults that you see having it today, is the little percentage of babies that theirs did not go after 1 to 2 years and their parents did not seek medical attention. Now this is when you need to seek for medical help. If the bulge becomes hard or painful, probably when you touch the area, your baby starts crying, your baby feels pain there, then you need to see your baby's pediatrician. And if after a year or 2 years it doesn't go, it stayed back, then you need to see your baby's pediatrician. After 4 or 5 years, I think it needs to be operated on. And that's why you have some adults that have a big belly button, because it was not operated on. They didn't carry out a surgical operation on the area to remove it. Okay, so it is very, very important for you to be watchful. That's the only care that you can give to umbilical hernia. Then if the skin of the bulge becomes discolored or it's red, you need to seek professional help. You need to see your baby's pediatrician. I mentioned that if your baby is in a lying position, umbilical hernia is meant to flatten, because that's whatever is passing through that hole that is causing that bulge is meant to relax as well. But if your baby is lying down and the bulge doesn't go down, it doesn't becomes flat, you need to seek medical help. For people that used to carry tape and seal the belly button whenever the baby has that bulge, please, there is no need for using tape. Please don't use tape to close it. As long as your baby is still within the ages of 0 to 2, it is going to live on its own. But if after that it doesn't, they will carry out a minor surgery on your baby and your baby will be fine. It's nothing to worry about. Now, if the umbilical hernia becomes strangulated, you need to rush and see your pediatrician, because it's a medical emergency. Now, other things you should note is that they don't press hernia. Don't go and start pressing it. For people that used to press it, or people that will put coin inside the stuff and bandage it. No, don't do all of that. Even when your baby cries, it is normal for it to bulge out. If your baby is crying and then it bulges out, it increases in size, you don't have to worry. It's more like straining and it's pushing it out the more. then you don't need to panic if your baby is crying and the bulge gets bigger. Okay, it is normal for it to get bigger when your baby is crying or when your baby is training. And make sure you visit your pediatrician, your baby's pediatrician, often. Again, watch for any sign changes. If there is any changes around that umbilical hernia, make sure you let your baby's pediatrician to know. Take note of when it happens, from the duration you start noticing the hernia, and everything you've noticed about it. Just put it down, and when you visit your pediatrician, you let them know. Then always encourage tummy time. You can put your babies on their tummy whenever they want to play, and you already know it's from the ages of 6 months. You put them, encourage tummy time, and watch them. Make sure you don't have anything harmful around them during tummy time. This is going to help the abdominal muscles to strengthen very well, and it's going to help the hernia to heal quickly. Now, what may make the umbilical hernia not to leave after 2 years? It might be because of a large opening. Okay, the hernia may be very large, which is a defect size. It is not the normal or the regular size that closes up on its own. Another thing that can cause this is delayed muscle development. Okay, when the abdominal muscle is being delayed, it doesn't develop fast. That's why I said it usually happens in premature babies and underweight babies. Another thing that can cause this is genetic or congenital conditions like Down syndrome or hypothyroidism. You know, the thyroid gland takes care of the function, which part of the body needs this, needs that, at what quantity, and all of that. So when you have hypothyroidism, it can as well affect the hernia from closing up. One can also have connective tissue disorder as part of a congenital condition. Lastly, what can cause this is increased intra-abdominal pressure. When there is increased pressure in the abdominal region, it will not allow this umbilical hernia to heal. So I believe with this information you have about umbilical hernia and umbilical granuloma, you know what to do when you come across this medical condition, and you know that you don't need to run helter-skelter. If you know you find this video helpful, please give it a thumbs up and share so that other parents will learn from this video. If you've come across this condition before, or you have something to say about these medical conditions, please leave it in the comment section. I would like to see your comments. Thank you very much, and see you in my next one. Bye.